Knock, knock, knock. Hi, my name is Julia Barron, and I'm going to be your Bellarmine University nursing student today. I'm here to do an examination of your abdomen. Let me go ahead and check your name and date of birth. And you are Alan Abdullah, and your birth date is 12/18/1948. Pleased to meet you, sir. I'm going to be, as I said, doing an abdominal assessment for you today. Any findings that I have, I'll share with you, and then I'll also let your nurse know as well. I'd like to start by getting my gloves on, and I'm just going to do a general overview of my patient. You're already in a recumbent position here, so that's going to be nice for me to just kind of stand back and look at his abdomen and note that it's not protuberant, but it is not flat either. I would call them round. It looks symmetrical on both sides. Looking at your generalized skin color, I'm seeing that you're pink, no signs of jaundice, and your skin color is within your ethnic background. The masses, ascites, are pulsations, so we're going to go ahead and just pull your covers down a little bit and then your gown up. That way we can see that abdominal area. And if I saw any kind of masses or pulsations or ascites, fluid-filled area, I would note that as well. His umbilicus is midline. I don't see any inflammation. I don't see a hernia. I could have him raise his head up and see if something shows, and no piercings. When I move on to auscultation, because we do that before we do palpation in the abdomen, I do want to realize that I'm going to be using the bell part when I'm checking for any kind of bruise in arteries, and I'm going to be using the diaphragm, which I have it on now, in order to listen to bowel sounds. So we want to start at the right lower quadrant where the ileocecal valve is, and that's typically where the first bowel sounds will be heard. So I'm going to be listening in 4 quadrants: right lower, right upper, left upper, and left lower. And I hear gurgling. Gurgling, gurgling, good. And again, I hear bowel sounds present. Now, in order to check for any kind of bruise, I turn to my bell, look for the umbilicus, and just go up. And I'm going to be checking to see the aortic. And I'm listening for like a whirling sound. And if I did hear something, I would also want to follow with my fingers and feel the pulsation. And if there was a size, I would check that as well. And the iliac arteries as well. If I go back to my diaphragm and I listen over where the liver should be, I'm listening for any kind of a friction rub if there was an enlargement, and over the spleen if there was a friction rub enlargement. Now let's go ahead and see if there's any kind of light palpation, so just 1 centimeter. And I can again start in that right lower, and typically you'd be on the right side. It does help you to perform this test better. So right lower, light palpation, right upper, light palpation, left upper, light palpation, left lower palpation. Let me come over to your other side here. Okay, so I'm feeling any kind of muscle resistance when I did that light palpation, and if there was any kind of tenderness, it should be non-tender. And then deeper palpation in 4 quadrants, and for that I'm going to be feeling the organs underneath. So you can do it bimanual, that works, and I'm going down about 3 centimeters. 3 centimeters, 3 centimeters. Often when they have a distended colon, that's when you're going to feel it at that time as well. Let's go ahead and check to see if we can feel the liver. So I can put my hand behind and then up and under, have the patient take a deep breath, and you may palpate the edge of the liver. It shouldn't be too far out, otherwise it would be considered, and you probably would have heard a friction rub if they had an enlarged liver. You can do the same thing for the spleen on this side. So you can do that where you put your hand behind, bring forward, and then palpate downward. And then you can do the same thing for the kidney. So lower, and you may just feel that edge, but not feeling it is still a normal finding. Okay? And over here as well. Just checking to see if I can find that kidney. Let's go ahead and say the patient had no kind of masses, there was no organomegaly, but if he did have a mass, I would make sure I would note what the location was, what the size was. Each one of my fingers is 1 centimeter, so that's easy for me to measure. The surface, is it smooth? Mobility, is it moving? Is there a pulsation, or is there tenderness? So if they had an abdominal aortic aneurysm, you might actually feel that pulsation, and you want to try to find the size and see if there's any kind of tenderness or pulsation with it. So let's look at the abdominal test. Now, when I was checking for the liver, that would be very similar to checking for Murphy's sign. So when you're palpating for the liver, if they had an inflamed gallbladder, that's in that same area, they would have pain. It's not always finding in the older population, but that can tell you that their gallbladder is inflamed. The iliopsoas muscle test actually tells you the obturator, which is right near where the appendix is. When you raise up the right leg and push down on the thigh, that will push on the obturator muscle, which is near the appendix. So that can be a sign of early appendicitis. It is not always present when there is appendicitis, so you have to realize it's only part of what you do. The Blumberg rebound tenderness, hopefully normal would be that there would be negative or no pain, but you can actually palpate deep down about 3 centimeters, straight down 90 degrees, and when you release, they'll have rebound tenderness on the other side as those abdominal contents move. Another one to check for is the fluid wave. For this, you may have the patient put his hand in the middle in order to kind of stop the skin from just vibrating, but then holding your hands on both sides and slapping with one hand, actually feel that fluid wave go over to your other hand and see that fluid move. So that would tell you that your patient had ascites. Okay, I think those are all the signs that we're going to look for right now with the patient. So if there's any questions, please let me know. Otherwise, thank you very much for being able to assess you. And if you have any questions, let me know. I will let the findings, I will let your nurse know what the findings are. And that's all. Thank you.